Hello everyone, this is Ronnie Smith, Acting Director of the Ralph H. Johnson VA Medical Center. I want to give you another quick video update, some of the recent changes we've done in our response to the COVID outbreak. We've had a few significant changes. First quick update was the big announcement this week that we're starting to partner with MUSC for their drive-up testing. For both veterans and employees that are home and feeling COVID-like symptoms, they can reach out to us for possible testing through MUSC. For veterans, they can contact their primary care team or go through the tap line. For our staff, they need to contact their supervisor and employee health. Employee health will discuss the health issues the employee is experiencing and, if appropriate, refer over to MUSC for testing. We're sending a list of those individuals to MUSC each day, and MUSC reaches out the following day for same-day testing. For our first day out this week, we had 15 individuals referred over, so we're really excited to have this option available for our staff and veterans. We're seeing results now within 24 hours from MUSC, so we're able to get quick answers for those individuals. The testing is available over at the Citadel Mall campus, MUSC, outside the Health West Ashley Medical Pavilion, and MUSC staff there will be prepared to take care of you once you're called and an appointment is set for you. Additionally, we've started up pharmacy curbside pickup and delivery for any potential veterans that are COVID positive or suspect for COVID. The service is available from 7 a.m. to 6:30 p.m. Monday through Friday. And we have designated pharmacy delivery spots for those individuals. We also have after-hour service available through our emergency department from 6:30 p.m. to 7 a.m. Monday through Friday as well. As a reminder, non-COVID patients can still pick up at the pharmacy window, and we still have overnight delivery available, and also our routine deliveries available through the CMOP. A quick reminder for individuals, we've seen some individuals as they go through employee screenings and getting the bracelet each day. Some have been accumulating those bracelets each and every day. We want to discourage that. We want to make sure that every person's getting appropriately screened, and we know if a person's been screened that day. So for those that have been collecting the rainbow of colors on their lanyards or some such, please just only have the one for that day available to us. That's for everybody's safety and awareness of if everyone's been screened appropriately, and so please ask everybody's compliance with that. In addition, I wanted to let you know we now have set up a separate mental health unit for a potential COVID positive mental health patient, knowing our mental health ward is a very confined location. If we ever had a positive patient, we would need a safe environment for them that's separate from the rest of the units. We have set that up in addition to our COVID ICU area and medical surge area as well. In addition, we are making some changes outside our ED. We set up a triage tent where we can move to having some of our ED triage done outside of the actual ED in an event that we see a wider spread of COVID and have more patients coming in. We can do it in a little bit safer environment, better provide appropriate screening and treatment for those that are potentially COVID-related, while also being able to still provide all the necessary ED treatment that we provide on a day-to-day basis that's outside of COVID. Another move we've made recently is we moved our infusion clinic again to the Veterans Enrichment Center on the campus. This is a great area for our infusion clinic for the rest of the duration of our COVID response. It's a more secluded area, so those veterans that are immunocompromised will have a great location to go to for their wellness and safety and not have to go through as much of the medical center as previously done. I also wanted to say thank you for all of those individuals that have written in and asked questions through our COVID Q&A email address, which you'll see on the screen here. A couple of questions we've gotten here recently. One was about PPE and donations. I want to say thank you very much for all the community support we've gotten related to PPE and donations. But I will let you know that we have a good supply of PPE in all of our major categories on hand and within our region that we can also lean on for support. So at this time, we're actually somewhat limiting the donations we receive from the community. It's been wonderful support from the community, and really appreciate those partnerships. By that time, we're in a good position with our PPE, and some of those resources can be sent to other locations that may need it more than we do at this time. In addition, I've got a question related to how our CEPID testing is going. You may remember we now have in-house testing for COVID through a piece of laboratory equipment we have here. It's great to have that testing available. We still have a limited number of tests we get per week that we can do, so we're only using it related to our inpatient needs. But with a test that we can get a turnaround in within an hour on if someone is positive or negative, we no longer have a category of a person under investigation on our inpatient setting. We know within the hour if someone's positive or negative, and can appropriately place them on the inpatient setting that's appropriate for their level of need. To this date, we still have not had a COVID positive inpatient at our medical center, but we know at some point we will, so it's good to have that testing available to us so we can put them in the right location at that time. Overall for us, we continue to have a very low number of COVID positives in our community. For staff, we've only had 5 so far, and for veterans, only 9 have tested positive so far. We do expect that to increase over time, but that is a much lower number than initially expected for our community. So we want to appreciate everything everyone's been doing for that social distancing, staying at home. It really is making a huge difference. The volume of patients we expected, both on inpatient and outpatient side, is really starting to diminish because there's just less cases out there because of all the actions you and everyone else are doing. So thank you very much for that. It is making a big difference for us. In addition, we've had some great virtual town halls. I want to thank all of our administrative staff at the warehouse, James Island, and some of our other administrative leases that participated in our employee town hall last week. And then also the outpatient nurses who did our first virtual town hall. It was really great to be able to interact with you. Coming up, we're going to be doing one with our community living center, knowing they're kind of in a very locked area that we've designated that way just for the safety of our patients in that area. But we want to better reach out and talk to them since we can't visit with them on a face-to-face basis. In addition, we'll be having some more virtual town halls with our CBOCs since we're not able to make it out to those sites at this time. And so that's all for the big updates this time. I just want to remind everybody, continue to wash your hands with soap and water and keep the social distancing because it is making a difference. Thank you very much. We'll talk to you soon.